Mothers and fathers in Hoosick Falls, New York, right down the road from my home, are crippled with fear about whether their children will be safe, whether the water that they bathe their children in, whether the water they cooked food for their families in has created a toxin in their bodies, in their blood, that they won't be able to recover from. It is a huge issue. Dr. Bricey, you sat with me at the auditorium in Hoosick Falls High School nearly 3 years ago, and we heard the most heart-wrenching, powerful testimony from these families. PFAS is also hurting families near Stewart and Gabreski Air National Guard bases in New York, because for years, obviously, as we heard from earlier testimony from Senator Rounds, has been required that our firefighting training, our foam, actually contains these chemicals. Access to clean drinking water is a right, and protecting clean water must be central to the work we do for all of us. This is not a partisan issue. I'm working across the aisle with Senator Capito, as she said, to draft legislation to address PFAS in our drinking water, which we will be announcing soon. So Dr. Birnbaum, I'd like to start with you, because the health risks are really what certainly my constituents in the audience want to hear more about. We know there are serious adverse health risks associated with PFAS chemicals. The science is abundantly clear, as I've heard from the families affected. It is such an important and powerful issue. Could you talk about some of the health risks associated with exposure to short-chain PFAS chemicals like Gen X, which the industry has developed to replace PFOA and PFAS?
So there are a huge number of short-chain chemicals. Gen X, the industry has actually conducted studies which have shown that these chemicals impact the liver and other tissues and actually cause tumors in both the rats and mice in those studies. That's Gen X. Gen X is eliminated from the human body quite rapidly, but it essentially is never eliminated from the environment. The problem with all of these chemicals is that the carbon-fluorine bond is extremely difficult to break down. So these are chemicals that are essentially forever in the environment, even if not in our body. Some of the other short-chain chemicals, recent results from the National Toxicology Program have shown that some of the short-chain chemicals like PFBS, which is a 4-carbon chain sulfonated chemical, is associated with essentially the same effects as the PFOS and the PFHXS. There are papers published literally almost every day showing effects of many of the different short chains as well as the long chains.
Can you tell us some of those effects for PFAS exposure, particularly for pregnant women and for children?
There were papers that were just published this week showing impacts, for example, on increased risk of type 2 diabetes in the offspring and increased risk in obesity in the children following in utero exposure. Also, evidence that gestational diabetes can be associated in the mother with exposure to some of the shorter chain compounds.
Do you think it's possible to develop a total PFAS or total organic fluorine method for testing and monitoring PFAS in our drinking water and groundwater?
So there are methods that are being developed to look at total organic fluorine. It's very important if you're dealing with water that you are able to distinguish between the inorganic fluoride that is added to many of our drinking water systems for dental health from the organic fluorides. And there are several methods that are currently being used and being further developed. I think it's also interesting that there are methods that are being used to measure organic fluorides in products and in human blood and serum.
Okay.
So I think that's...
So I would love some recommendations for the committee on that, if you could put that in writing.
Sure.
Dr. Breezy, I only have a few minutes left, but what can the federal government do to prepare the victims of PFAS exposure for the serious health consequences like cancer and kidney disease that we'll expect to develop? And I ask specifically because through the 9/11 health bill, we developed a medical monitoring program that is actually saving lives and making sure there aren't misdiagnoses, to making sure we have experts in the field who understand what these risks are so they can diagnose these illnesses early. What do you think the federal government can do or should do?
So giving advice to the clinical community is crucial going forward. When we go into communities and we measure PFAS levels in people's blood for whatever reason they might be doing that, the first thing they do is they go to their doctor. So we have an aggressive clinical outreach program as part of our work. We go into communities. We have guidelines for physicians we publish on our webpage. We support, along with the EPA, the Pediatric Environmental Health Specialty Units, which are clinical facilities that are designed specifically to answer questions like this. And so we constantly refer the local medical community to our PACEUs to get those concerns. We hold ground rounds to clinicians when we come into communities, and we're reaching out aggressively to communities about these issues.
Thank you.
The medical communities.
Mr. Chairman, can I just ask for unanimous consent to include some statements from two of my constituents in the record, Mark Favors and Lorraine Hackett, who is here, describing the experiences of their families resulting from the exposure to PFAS chemicals in their drinking water. As I said, these stories are heartbreaking, and I just hope that all of my colleagues will take the opportunity to read them so they know the real, intense, personal impact this issue is having on people's lives.
Without objection.
Thank you, Mr. Chairman.